Hello, this is Group 12. I've been working on IVUZE app and would like to take you through the progress and the technologies we have been using. Before we go through the presentation, I'd like to present you my members. We were with Muhammad, Ange, Ivan, me, Munya, Samuel, Mariren, Dennis, and Kevin. So I'd like to give them the time to explain for you all technologies and the flow of the project. Thank you.
Hello, my name is Shema Ivan, and I worked on the front end of the IVUZE app, and I will be introducing the problem statement. IVUZE Web app is, identifies the challenges faced by the patients in accessing specialist consultations and medical services in Rwanda's healthcare sector. Overall, the problem statement highlights the need to address these challenges to improve the accessibility and the quality of the healthcare services in Rwanda. The app aims to tackle the issues by automating the process, optimizing resource allocation, and enhancing the patient's journey through the development of a user-friendly website.
Thank you. I'm Dennis Nwaritaganzwa. I'm going to go in deep about problem statement. As we mentioned, my colleague mentioned before, accessing specialized medical consultation service from various hospitals in Rwanda was really a great challenge for patients, and as well as the upcoming result of inefficient in healthcare delivery and disparities in patient care experiences. So it is we tried to break it down into 5 steps where we talked about fragmentation of services, where hospitals and healthcare providers often operate independently, leading to the fragmented services. Also, we talked about limited availability of specialists, especially in Rwanda, where the country faces shortage of specialized consultant in different professions. We also tackled about lack of centralized information, where the patients struggle to collect the different information about their available specialty service and service offered, as well as booking an appointment. Also, there is financial barriers where sometimes it was hard to afford the service, and as well as accessing the service and consultation provided by those specialists. Also, and there was inefficient in referral system where there was no way to correct feedback from the patient, as well as there was the first customers of healthcare, so it was really hard to get the different feedbacks for future usage, and especially in referral systems. Thank you. Then my colleague can go ahead.
Thank you, Dennis. So I'm Samuel. I worked on the front end of the IVUZE app, and I'll be talking to you or speaking about how we got this idea for the IVUZE app. So at first, we looked into several areas in which we could have built a web app around. We looked at LMS, the learning management system, and throughout the learning management system, we talked about how we could bring students closer to teachers and like students in need of like required teaching, while another member talked about bringing doctors with specialists. So we talked about bringing those two ideas together to come and help the Rwandan citizens who lack healthcare and like available, readily created healthcare. Because a lot of Rwandans face the issue of long waiting times and long distances to get healthcare services. So because of that, we try to narrow that part and build a bridge between specialists and patients so that there will not be much of a gap, or there's no more a gap, but patients are able to get readily made healthcare at affordable rates. Now I'll be passing over to Ahmad that will be telling you about the solution and how we built around it.
Thank you. My name is Muhammad. I'm working on the back end of IVUZE app. IVUZE app project designed to transform the healthcare landscape in Rwanda. It proposed solution to address patients' challenges when seeking specialist consultation and medical services through the development of IVUZE. Our goals is streaming hospitals' operation, enhancing patient care, access to hospitals and specialists in the whole of the country. And the point, an essential point that we have to talk about it and the objective is first of all to improve patient access to specialist consultations and medical services in Rwanda. In one places, you could have the ability to get all hospitals with their all services provided with all specialists provided, reducing waiting time for patients seeking specialist appointment. It helps you to book appointments through IVUZE app and minimizing also conflicts while booking appointment in hospitals, and also enhancing patient care experience and satisfactions, and collecting and analyzing patient feedback from continuous improvement. And also the most important here is revolutionizing healthcare management system in Rwanda through the implementation of IVUZE. Thank you. I will let my colleague to continue with the following point.
Thank you to my colleagues. So my name is Ange Mukondeni, and I worked for the front end and data collection for this project. So I'm going to tell you what challenges we faced during this project. The first challenge is about working the online. So it was hard to collect the areas, especially for the GitHub. So to collaborate was so hard because we are not at the same place. So sometimes we face the errors, but we solve these challenges by creating the meeting, the in-person one, so that before anyone can push, knowing that someone push and make sure he or she pull before pushing any codes. And we face the issue of time, as I said before. It was not easy because we don't have the same schedules. So it was hard to do this project, but because we collaborate and we had same goal, we tried to solve this issue. So I can invite Mary and tell more about the challenges of technology, like how we coding. Thank you.
Okay, hi everyone. I'm Bieneme Madidan and I worked on backend part of the project. So firstly, I would like to take you through the technologies that we used during the production of this project. For front-end side, we used HTML, CSS, and JavaScript, and for the backend, we used Express framework and MongoDB database. So for real, it wasn't really easy for us to do the whole project because most of us was their first time working on hand real life project. So it was not really easy, but we managed and we tried to teach one another so that we can be on the same page. Also we can try to finish the work at the time. Yeah, I think no more challenges because we try to collaborate and complement one another. Yeah, I can tell the next one to continue.
So in conclusion, the IVUZE is just meant to showcase the way we could bridge the gap between patients and specialists. And this is the conclusion. This brings us to the conclusion of the IVUZE app. We thank you for listening, and we hope you can continue following us on this journey. We'll meet you on the final presentation. Thank you.